Welcome back to OpenLine. We are talking about health care. Where do we stand right now with the Affordable Care Act, also known as Obamacare? Where do we stand right now here in Tennessee? Obviously, Congress did not take a vote on repealing the Affordable Care Act last week, so it is the law of the land. And if you have questions about your health care, this is a good opportunity for you to call in and get them answered. Let's go to Taylor. Hello, Taylor.
Good evening, Ben. Appreciate this program. I am a person a little older but of pretty good health, but I have observed health care, insurance, hospital bills, and so forth all my life. And the biggest problem I see right now is the federal government already probably pays 50 cents of every dollar that goes into health care. And although I've always been opposed to a one-payer system, I think no matter which of these plans go into effect, we're going to wind up with the taxpayers probably coming up with 75 cents on the dollar. And if it gets that high, then why not the government just take over the whole thing as it's done in other countries? Now, we're a lot different than so many other countries, but the main problem I see, Ben and your guest, is we have got to get some kind of value pricing in all forms of health care. If you want to pay cash for your broken arm, you don't know if it's going to cost you $3,500, $700.
Right.
I mean, it's just amazing.
It is kind of astounding. I agree with you.
No matter what your problem is, now let's forget about cancer care or something like that. I mean, that's sell your house time.
Right.
But the insurance companies continue, even on Medicare. The insurance companies pay less and less, and the insured pays more and more, and the pricing from the medical care never seems to be addressed in any way.
All right, well, let's talk about that. Taylor, thank you. Thank you for that call, Taylor. Let's talk about that, because I think Taylor has a point. He's talking about it's so frustrating. You don't know what your bill is going to be. And he gives a good example, broken arm. It seems like you should be able to go and see, okay, it's going to cost here at this hospital, here at this hospital. We have no idea. And you all aren't political. I mean, so I don't know. I'm not asking you political here. But why is that? Do you have any idea why that is?
No.
Yeah. I mean, I think payment part of the Affordable Care Act did address payment reform and trying to switch to more like Taylor was saying, a value-based payment system, so rewarding hospitals for having fewer readmittances within 30 days and things like that, to try to move from just paying fee for service to more of a holistic. So, I mean, there have been efforts in that, but obviously, there's still a lot of room to go. And shopping for healthcare is pretty much impossible, like Taylor was saying. You can't really get a quote on these things, and that's why insurance is so important to have, because you don't know when you're going to need it, and then usually when you're in the position where you do need it, you don't have time to call each hospital or each doctor and try to get a quote. So
yeah, and it's kind of hard for insurance companies to know how to set pricing. You don't know how many sick people you're going to have. You don't know how many is going to have such catastrophic diseases. You're trying to. It's almost like you're trying to guess. How do I set pricing? Because I don't know what the future holds. How many sick people are going to come? If there's going to be a catastrophic occurrence that's going to cause a lot of people to have to come, you just don't know. And so they're trying to set this pricing and do their actuarial things, just kind of guessing. And it's kind of hard to set pricing.
And I ask you all before the break, and again, I know you're not political, but if people would get of a like mind, what are some reforms that could be done that maybe that would really improve health care? That it seems like both sides are so entrenched. Is there something that could be done in your opinions, I guess, based on your expert opinion, not political, that could help us with this, with what you all see? What do you think?
Well, I mean,
expanding the Medicaid, closing the Medicaid gap, and expanding Medicaid in this state because we didn't do it, I think that would help tremendously. Cover more people, and that's one of the big things, I think. Trying to get more younger, healthier people to come into the marketplace to kind of stabilize, and offset those that are really, really sick. That would kind of help to balance things out, and those kinds of things, I think. Mary?
There's a fine, right, if you don't sign up. But people still aren't signing up, right? Now, is the fine going to go up to the point they have to sign up essentially, or?
Right now, it's leveled off at $6.95 a person, or 2.5% of your income, whichever one's higher, and then they're just going to raise it by inflation. But there are some people who suggest actually increasing the penalty more. It's not the most popular aspect of the law, the individual mandate that everyone has to have insurance, but it's kind of one of those necessary evils if we're going to have everyone get insurance. If we bring everyone into the risk pool, including especially those people who may be the most hesitant to purchase insurance because they may have the lowest health needs, when we get those people in, it lowers costs for everyone. So one idea has been to increase the penalty.
And so when you hear President Trump say, I'm done with healthcare right now, he's moving on to other things, but he just wants to let the current system just kind of fall apart. In your view, will it? Like, how healthy is the is the system? If it's not reformed, if they just let it be for a year or 2 years, what's it going to look like a year or 2 years down the road?
Well, I mean, we can't tell the future, but we don't feel like it's in a death spiral by any means, especially in Tennessee. So, I mean, we still have, last open enrollment period, there was a lot of uncertainty, especially with the election falling just, a few days into open enrollment, and then the inauguration happening right before the end of open enrollment. I mean, those two big events happened during open enrollment, and we still had just as many people sign up as did the year previous. So I think that highlights that
it's working.
People still want the coverage regardless. So I think, even with talk of repeal and then now it hasn't gone through, I mean, I think people who still need the coverage are still going to want to get it.
They're signing up.
So I don't see it exploding. I think even the Congressional Budget Office, when they issued their report about the proposed repeal, said that the ACA currently is stabilized and it's not in a death spiral. So we don't see it exploding on its own.
I think people still are looking forward to enrolling for 2018 coverage. They're wanting it. I mean, we sit down with so many people that if it were not working, they wouldn't continue to come back. I have repeat people year after year after year continuing to sign up. Very grateful to have it, especially the benefits that they're getting through the preventive services and all of the essential health benefits that they're taking advantage of. So they come back year after year after year. And I know sometimes you hear the premiums have gotten so expensive and tripled and doubled and all that, but they're not saying how much the subsidies have increased as well. So you're hearing that the premiums are big, but nobody's talking about how the subsidies increased. And in this state, the subsidies increased at such a great rate that it made the premiums that I saw this year lower than the ones that were last year.
Now, see, that's very interesting. You're right. I think there's just all this information out there, and we don't really know. I don't know, what kind of to hold on to. That's very interesting. I hear that prices are skyrocketing. In Tennessee, there were reports about, it went up X amount, and it seemed really, really high. And I'm like, well, how can people continue to afford that? But you're saying the subsidy.
And see, that's the part they don't ever talk about, are the subsidies that people are receiving to be able to afford that.
Where are we in Tennessee? If a person in, Middle Tennessee, and I know it's now not open enrollment, so they can't enroll, but what are we talking about? A family of 4 in Middle Tennessee, what's the cost? What are their options?
It's so, I think the marketplace is so individualized because they
have lots of options.
The calculation for the subsidy is based on a lot of different, factors, like exactly their zip code, their household size, the income, things like that. So, but I mean, just
depending
generally,
on where they fall on that that line, they could go to Medicaid, or they could get a family subsidy that's quite substantial to be able to afford. And even where their income falls, the kids may still go to Medicaid, and the only people that would be paying for the coverage would be the parents, because the kids can get TennCare, whereas the parents may have to pay for insurance depending on the income. So it can fall all over the place. Don't you agree, Mary?
Yeah.
So it could. So it's really hard. I think that's a question people have. Like, okay, so what does it cost? But you can't answer just definitively.
Yeah, but what's so good about healthcare.gov are the tools that they have available for you to actually sit down and put those figures in for your particular family to come up with what it could possibly cost you. So they have a tool that you can put in how many is in the family, how much everybody, how much income is in the household, and does anybody smoke, and so forth and so on. And then you click that, and it'll tell you what you possibly would be looking at as far as a tax subsidy and a premium. So people can actually find out what it could look like for their family to be insured.
All right, great. All right, we're going to take a break. If you want to call, have a question about your situation, there's the number 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.